Welcome back, it's Dr. Somji. I'm going to talk about one of the trending treatments that I see absolutely everywhere now. It's lemon bottle treatments. I'm going to talk about what exactly it is, whether I think it works, whether it's safe, and also how to use it as well. So look, I don't personally offer lemon bottle treatments in my practice, shock horror, mainly because I don't like injection-related lipolysis, which basically means injecting anything that's a liquid to dissolve fat, mainly also in the face, because the face needs fat. One of the reasons why dermal fillers and fat transfers and things like that to the face are really so popular is that one of the things that as we get old is that we lose fat within our face. So when you've got people injecting the side of the face, as you can see in this video right now, you're gonna end up looking older, because if you inject something that dissolves your fat is adhered to the skin, and as the fat comes down, your skin is going to be super loose. So maybe like 2-3 weeks later, you look nice and contoured, but fast forward like 6 to 12 months, sometimes I've seen patients that have been injected with this injectable lipolysis stuff that actually I need to do something surgical to actually lift the face. Sometimes they need surgery to correct that skin laxity. So fat is good, it's not bad. Now, you might want to inject it underneath this area, the submental area, which we can see some great changes in there, which are akin to what I do with liposuction. And yes, you can get some good changes. When we do liposuction, back in the day when I used to do liposuction, probably like 10 years ago, I used to just do a little bit of lipo underneath here. And it used to make a really nice difference, much like these results that you get with lemon bottle. But then after like 5-6 years, I started to see these patients and you started getting loose skin in that area. And it's because you destroyed what's called the pre-platysmal fat, or sometimes even the fat that sits underneath the platysmal muscle, that's almost like holding those structures in. So you can actually get advanced aging for injecting removing too much fat underneath the chin as well. So you have to be careful. You don't want to get the short-term gains and have long-term problems. And this is my worry now, because everyone's injecting it everywhere like crazy, and they don't realize that actually you're going to look older in the future. Look, lemon bottle, as of when we recorded this video, is not something I inject within my clinic, mainly because it's not CE marked. There's no medical literature to show that it's safe or even effective, and it's not a prescribed product. So it's something that essentially dissolves fat, but it's not prescribed, which is slightly worrying because there's no set protocols in it. So even on TikTok, you got people saying, yeah, inject more because you're not getting the right result. Like, we don't know what the long-term side effects of these things are. We know the ingredients. You've got the ingredients over here online. You can see that you've got riboflavin, which is vitamin B2, which helps with like metabolism of the fat cell, also gives energy. You've also got lecithin, which helps destroy unnecessary fat cells. And the main active ingredient that you've got is bromelain, which is pineapple derived. So that's the thing that's going to help with lipolysis, inflammation, as well as reducing swelling. And definitely what it seems like comparatively to other injectable lipolysis treatments like Aqualix, you're not getting that bloating swelling that you can get from fat necrosis or destroying the fat. So it's certainly a gentler treatment, but don't be fooled, because if you remove that fat layer, much like you see on this demo that you can see on someone putting essentially a lemon bottle onto bacon, onto the fat, you can see that, look, she's separating it. She's saying, look how good at this is breaking down fat. But what you need to remember is that if that's someone's face, their face is becoming like this. It's becoming looser. So you're removing that fat layer that's actually holding everything together, and then actually you're aging the face. So this is my advice. You can use lemon bottle on areas like on the bra fat, as you can see on this video. If we pause at the end of the video, you can see that there is a change between the fat pockets that are sitting in this area, but it's more camera trickery, because the bra fat, the clasp is actually on a more tighter clasp on the first one than it is on the second one. So Actually, it's not a comparative image, and actually if you're going to get that treatment on the base of that video, definitely don't go to that person because they're essentially misleading you. And that's the reason why, like, you know, I don't trust these treatments because they're not approved. So there's no studies to show that they work. Don't get me wrong, I love new treatments, and I do clinical studies to get FDA approvals for a lot of devices, and I do medical studies, which you'll see in literature that I published for things to show that they actually work, where we actually test it properly. So lemon bottle might be the next big thing, but I would not get the treatment at this present moment in time until there's proper medical literature to show what exactly are the incidents of side effects post a treatment, 2, how effective it is and in which patients it's effective, and 3, once it actually gets proper approval. In fact, a CE mark is probably not enough. CE mark you can get like literally with just filling out a few forms, but FDA approval for actual, to show that it actually works for fat reduction, that's when you would really start using it. So you've got to be really, really cautious. I'm not knocking lemon bottle. You're going to get some people saying on over here, it's worked amazing. Okay, maybe it works, but just because something works, just because you can press the foot on your gas in your car, it doesn't mean that you won't crash. One other key point, which if you look at this video and you're like, look, I don't want to listen to Dr. Somji, I still want to have their treatment. Just do me one favor. Don't get it done on the face because you're going to make your face look older later on. If you want to do it on body areas where the skin doesn't really get so lax afterwards, where the skin is thicker in the body, then maybe you can try it and see what you want to do. And at the end of the day, it's non-surgical. There appears to be no real downtime with the treatment. And as long as it's performed by a trained medical professional, then you should be okay. The reason what you need to really look at, and what is really the case in the UK, is that not many medical practitioners, i.e. doctors, are offering the treatment. And that should tell something to you, because when non-medical professionals are injecting it, they don't really have risk of their license, because if somebody comes back with a side effect, they'll just be like, well, I've got insurance, it's there. If I have a side effect, then my medical license is at risk. And therefore, I'm very cautious about which treatments I bring into my clinic because I need the adequate medical evidence. So, you know, what I'm saying is wait and see. And that's always better to do. It's like people that bought crypto before and they rushed and bought it. Yeah, you could probably come onto something that's really good, but really the clever people just watched and waited before they actually invested, and they actually ended up being having better outcomes with it. So same thing with medical treatments. Just when you're injecting something in your body, you need to know 110% about everything, every possible side effect before you have it done. And that's my advice. So there we have it. There's my view on lemon bottle. That might change over the next few years. And if that's the case, then we'll upload another video. And if you're subscribed and you've clicked that bell button, then you'll be the first to know. Thank you so much.